Of interest for you who are interested in spasmodic dysphonia, James Johnson remains cured of his condition 20 years after he was diagnosed at the Mayo Clinic. Dr. Arnie Aronson, who diagnosed him at the Mayo Clinic 20 years ago, a hospital record, with the most severe SD, spasmodic dysphonia, that you can imagine. You heard it. Acknowledges and verifies that Reverend James Johnson has a perfect voice, and he has had a great voice for 20 years. You move from an improvement to a recovery to a cure. That's how it's done. You don't just get a cure of spasmodic dysphonia. The progression is they get a handle on the voice, putting the voice up in the face, away from the lower throat, changing the image. The image is a factor I wrote about in 1971 in The Art and Science of Psychotherapy. This is the area that the academicians in my field and the medical community ignore. It is the placement of the voice in the face that when you change it from the lower throat to the face, and that can be done, which in a sense disproves the fact that it's a dystonia. Dystonia means that it cannot be changed. It's neurological. When you have cerebral palsy, you're not going to change from cerebral palsy to a normal gait, because I've spoken with the individuals. I worked with cerebral palsy cases when I was at UCLA and many other types of cases there. And you don't change the cerebral palsy. You can change the attribute, the voice and the speech, but that takes doing a lot of doing. But you will not change the cerebral palsy. James Johnson could change from the lower throat to the face. He couldn't get a handle on it. The 50 hours a week, which was done 20 years ago, is now down to 25 hours a week, because I've learned how to get more to the source by direct voice rehabilitation. Direct voice rehabilitation is not speech therapy. Direct voice rehabilitation goes to the precise variables, I find, that are creating spasmodic dysphonia. All spasmodic dysphonia is in the lower throat. I agree with my medical colleagues and my colleagues in academic land. And when you change up to the face, I'm down here, you're talking like that, it sounds like you're loud, that you're robotic, that you're artificial. It's not you, it's superficial, it's someone else. And you have to get the patient accustomed to the new sound. In 1971, I wrote about the voice image as unspoken behavior. The medical community and the people in my field, the speech pathologists and voice pathologists, do not understand and do not discover the voice image. They don't realize that this is the very factor when you can mechanically, functionally change from the lower throat to the face that is the negative to the individual, because they're not going to use a voice they feel uncomfortable with. There was a gentleman in the University of Michigan some many years ago who found that we hear ourselves through the bones of our head 3/1000 of a second faster than we do from our mouth to our ear. So we are accustomed to the sound internally, and when it's changed from this voice to this voice, the individual reacts to it negatively, and you have to work with that attribute and have the individual understand they're not loud, they're not offensive, and so forth. 20 years ago, it took 50 hours a week to change Reverend James Johnson's voice. Today it takes a much shorter period of time, and I use group therapy, which I find very effective, because the patient can bounce off the other patient when they're talking like this, and they talk like that, and they tell me and they tell other patients that they're loud, they're shouting, or robotic, artificial, superficial, phony, and so forth. The other patients in the group say no. But they themselves, when they change their voice from the lower throat to the face, getting out of spasmodic dysphonia, they will say the same thing that the other person has said, because they too hear themselves through the bones of their head, not from air conduction from their mouth to the ear, which is fascinating. And the group is very, very rewarding and very meaningful in that sense. There's playback and there's give back. So the patients can realize they're not loud, they're not offensive, and not just accept what I'm saying, but they can accept what others say in the group, and that makes all the difference. That's one attribute. The fact is that spasmodic dysphonia itself is considered to be a psychiatric problem at one time. In 1960, Rowe, Brumlick, and Moore had tentative views about spasmodic dysphonia, saying there were spikes in the brain. There were only 10 cases involved. That study by Rowe, Brumlick, and Moore has been the foundation for the neurological belief that SD is a dystonia, possible dystonia. It was never proven, and the study indicated very, very clearly that it was just a tentative, inconclusive view. Some of the 10 cases had spikes in the brain. I think the spikes in the brain come from the forcing in the voice down the ear, and the eye spasms, and the neck spasms, and the back spasms. I've been able to remove those spasms, I know it's hard to believe, by changing the voice from the lower throat to the face with midsection breath support, with the patient understanding the image. Let's take a listen to an additional segment of Reverend James Johnson's new voice.
I have had numerous calls and letters from people from all over the country.
I think God does that.
Yes, I think so. So I felt there was a very direct purpose here for my going through the whole experience and finding Dr. Cooper and being able now to share the message. There is some hope out there.
That really is a witness. And normally we don't hear about people being healed or cured from some type of voice situation.
I have a textbook, and I have these books, and I have an audio and a video of recoveries from James Johnson's Strangled voice, an audio and a video on that very thing showing recovery and cure. The medical people say that's impossible, and they don't allow me into the medical meetings.
And I would think you've gotten a lot of criticism from refusing to go from a physiological or a medical model, but rather going with a functional or a misuse type of model.
Yeah, I say it's educational and rehab in nature, and they're saying it's a neurological problem. They also believe it's genetic. They, in a sense, are simply not aware or not willing to accept the fact that there are cures, although there are cures. And I've been doing it for 20 years, and I reported in the top journal, and they know that, but...
How did you get this idea that maybe we need to look at something besides a medical model?
I was a professor at UCLA Medical Center and ran the voice and speech clinic for them in part. And we never had one success, not one success by the medical model, which means we're using drugs and pills and shots.
Surgery.
And that. Then I left the medical center about 10 years after, and I went to private practice. I'm in West Los Angeles. And I began to report cures because I use this technique, the Cooper Instant Voice Press, and the voice up here. And I provide patients with options and alternatives and informed consent, so that UCLA sent patients over to me. Gail Pace had the condition, and she was hopeless. They said she had abductor and adductor. It's the worst, and I got her out of it, and I got a patient out of the Stanford University, a professor out of it. James Johnson, incidentally, the Mayo Clinic reports and closes his case saying he's cured.
And that is a congratulations. And I'll bet there were times you felt hopeless also.
Oh, yes, there were many times I was ready to give up.
Jim, I want to go back to some of the psychological ramifications. How difficult was it to make friends, to go to social events?
Well, that was rather difficult if it was with a group of strangers, say at a wedding reception or some public function where I didn't know people and they didn't know my voice condition. So you were always caught explaining. They would come up and say, "Are you crying? Do you have a cold? What's wrong?" They would always ask. And so you'd always be explaining yourself.
Did you want to get a sign that says, this is difficulty here? Yeah. In doing weddings, in doing funerals, was there a sense that because people are so focused on my voice, it takes away from the quality of what you're doing?
Very definitely, yes. The voice got in the way of the message, which is a very big problem in my area.
Tell us the effect on self-esteem from having this and now.
Oh, okay. There's just a vast change in self-esteem. When you're living with spasmodic dysphonia, you've come to feel that there's something definitely wrong with you, and of course, some of the excuses given are that you're going through a psychological problem, and I was told that too. You're stressed out. You're dealing with some problem that makes you unable to talk. So I went through counseling to try to deal with that, and there wasn't any problem that I could find that was serious enough to cause this voice
trying
problem.
to locate those problems.
Yes, I thought if you can find the source, you could deal with the problem. But after regaining my voice, it was like a rebirth experience in a lot of ways, because it reconnected me with the world. It gave me a new sense of vitality in my ministry, a sense of wonder and joy at what I was doing, no longer a labor, a tiring task that I had to do, but a joy.
When you hear your voice on that tape, the distinction is such between then and now that it's almost like talking to a different person. There is no hint of that. So do you consider yourself cured?
Yes, I do. I consider myself, having gone through a change, I am a different person, and I feel that I am cured. If I do have any slips at all, which I think are probably natural, I think we all slip when we speak. We who've gone through the condition,
his head over here. Yes,
we who go through the condition automatically react like, oh, am I losing my voice again?
Sure.
But I know how to control that, put things in place properly, focus correctly, and it just momentarily, I'm doing what I need to do.